Hello, hello. We are live and we are back. I skipped yesterday. And you know why? The taxes. It was tax day. And I decided to do my own taxes. Mine are corporate taxes. It took me 17 hours. So I couldn't come on here, but I'm back. And now I'm back better because I'm ready to focus on I call it the global saving money movement or challenge. Okay? Focus on I call it because I think you agree that we don't have money. We don't save money. If you are lucky enough, you're going to be like making enough just to, survive. So I put it upon myself to say, you know what? Let me talk to them about knowing even how much you spend every month. Because sometimes you spend money according to what's available, right? I have this, I can buy that, and without going over to know if actually you have even enough. Because you have to look at the amount of money you make and the amount of money you spend to even know that you are good. Especially here in America where they mix it up with credit cards. You buy some things on credit, you mix it up, then you're not sure you are red. So what happens? You are in red. I went and researched 10 expenses. 10. Today we are discussing healthcare expenses, healthcare costs, but I researched 10. And I put people on Zoom and discussed all 10. And I asked them to put a price on how much they're spending on each one of them, and then deduct from their income they're making to find out if they're making money. I mean, if they are underwater, meaning you're in red, you're making less than you spend, or you are good, you're in black. And then if you're in black, we'll say, let's save some money, let's invest, and let's have some passive income. That's why I wear these shirts, because this is where we make the passive money. But we have to first make sure we have the money we have the money to pay our bills every month. Then we get into the next stage. Okay, and if you don't have enough, then come. Let's learn how to make enough. Okay, if you're seeing me for the first time, I'm Sherifa Nakalema. I'm in Virginia, USA. I'm passionate about financial independence, financial freedom, making your own money, making passive money. Passive means it comes every month. Starting your own business, those kind of things, doing what you love, like see me, I love what I'm doing, I work from home. Yeah, those are the topics. Please like the video, subscribe to my channel if you care about those kind of things. And I think today I didn't even link. Yes, I did. If you see my pinned comment right there, I have a free community where you can come and we discuss this, how to make money on school. And if you find this video later, the pinned comment will be that's where the link will be. But it's also in the description. Okay, so let's talk about these healthcare costs. But before I even do that, I have to remind you the ones I've finished. I finished, number 1 was housing. I finished number 2 was utilities, like bills, water, electric, and all that. You wonder what I do. I list all of them, and I discuss it, and I share how you could save, to save money, right? Number 3 was food and groceries and household items. Number 4 is today, which is health care. So this one I'm going to cover, I think 5 areas. What is included when you say health care? What do you mean? What do you mean? What are the costs we're talking about? Number 2, how do you prevent? I was researching. It's funny, not funny. It's fun. How to prevent yourself from getting sick. Because if you prevent from getting sick, then you won't spend money on healthcare. Number 3, okay, not much money. You could still pay like insurance, but it'll be lower premiums because you're a healthy person. Number 3 is the sicknesses that don't require you to go to the doctor. Number 4 is what I'm covering, ways to save on healthcare costs. Then number 5 is going to be the tests, preventive tests that I suggest you do take to prevent from these big things happening to you. So I have tests that are recommended for men and tests that are recommended for females. See, it's a busy line of things. As I'm here, there are not so many people. There's Kalipala. Welcome, Kalipala, Harvard. Welcome, but I continue to put them out there. And I also noticed that YouTube doesn't like this format because I'm using StreamYard, by the way. If you are a YouTuber, you may wonder, how do I do this? It's called StreamYard. It may look like Zoom. It's not Zoom because I'm live. It's StreamYard, and if you want to try it out, it's free to try it out. There is a link in the description of this video. There is a StreamYard link. You could go try it out, but YouTube doesn't like it. They want us to come like this. They are not promoting these videos, but I still do them anyway. So for you to find it looking like nice. Okay. What do we mean when you talk about healthcare expenses? So what I'm going to list, I did some research, and I'm going to list, you may wonder why I'm talking about healthcare. I'm talking about healthcare because I'm talking about expenses, the things that take your money. I'm not a doctor, I'm not a nurse, I'm not any of those things, but I care that you save money. So I research and I report right here. Anything to do with business, I could share. Those ones, I have some expertise there. Okay, what is included when we say healthcare expenses in your budget? What could we find there? Number one, if you are like in USA, healthcare premiums, you pay monthly. As I'm speaking right now, the government of USA shut down because of these healthcare premiums. Because the Obamacare, the price is increasing, the premiums, and the Democrats decided to, okay, the Republicans, I don't know the real details of these things, but the Republicans, they made in their bill, should I talk about these are political things? Just know that the reason why the government is shut down in America is to do with healthcare costs. And the Democrats believe that people, after November, I think they say, people are going to get these bills going higher for Obamacare. The subsidies, I think, are expiring. And the Republicans caused that. So that's the disagreement. I'm not a politician, please. But that's what's going on. That's how you know that healthcare is so important. The whole government is shut down because of the negotiation. They failed to negotiate to come to an agreement. So that's the reason it's shut down. Okay, healthcare insurance is going to be one of your costs. Doctor visits, like if you have to go to a doctor, then that's a healthcare cost. Prescription medications, the doctor say, go get this, go get that. Over-the-counter medication where you just go buy some Tylenol in the news too. You go just buy something over the counter. All that is health related. Then dental, cleaning, fillings. I have mine tomorrow. I have to go to the dentist tomorrow. Braces, vision care, eye exams, glasses, contacts, all that is under healthcare cost. Mental health services, therapy, counseling, hospital stays, emergency care, lab tests, diagnostic scans. They say go do a scan. Medical equipment, crutches, hearing aids, preventive care, vaccinations, checkups, alternative care, chiropractor, and all that stuff. Out-of-pocket costs and copays. All that is going to be in your bill monthly in there. Okay, make sure you reserve for that. Then number two, how do we prevent getting sick? Because if you are not sick, you wouldn't go to the doctor. You don't need all these things. Although some of them are preventative, you just do prevent. But let's go see what the list I found. I did research. Okay, number one, eat balanced, nutritious meals. Number two, stay physically active. How about you testify to that, right? Go for a walk, go for a jog, okay? Get enough sleep. That would be my issue. Today I slept like 10 hours. Because yesterday I didn't sleep because of the taxes. Now I overslept. Yeah, I feel good. So they said get enough sleep. The doctor, we had a doctor on the other day, and he said at least a minimum of 6 consecutive hours. And if you don't, in fact, I was researching it today again. Someone said if you can't get 6 consecutive hours, you are in big trouble. Make sure you compensate. Yeah, like if you don't get it, then find a day to catch up with your sleep. But believe me, sleep is important, and I'm one of those people who don't sleep enough. So here they're recommending 7 to 9 hours. Stay hydrated. Drink water, tea, stuff like that. Wash hands often. You know why they said wash hands? Because of the germs. You know, during COVID, we knew how important it was that we wash, we clean up. And you know the item they say that brings diseases? Your phone. That the phone, you need to wipe it. You need to wipe your hands because of where you place it. You just place it here, you place it there. You are placing it in the wrong places. And some people take their phone to the bathroom. Wow. They say all the germs are all right there. So Wipe. Go back to sanitizer. Yeah, wash your hands and also wipe your phone. Okay, manage stress and mental well-being. Don't allow stress to come to you. Yeah, that happened to me a lot. Now I stopped that. I don't allow things to stress me right now. Avoid smoking and limit alcohol. Wow, that's hard for some people, but avoid smoking and limit alcohol. Keep up with vaccinations and regular checkups. Regular checkups is what I'm going to end with. I have a whole list of things that a man should do and a woman should do to keep up with these tests and screenings, okay? Maintain a healthy weight. What is a healthy weight? Your doctor will tell you if you ask. It will depend on your height, the height and weight. For a short person, the weight will be different than for a taller person. So it's going to go by, they have to tell you which is good for you, which is the right for you. Right now, I'm big. I have to lose, like, if you talk in terms of pounds, maybe like 20 kilos. I mean, well, how many kilos? How many kilos and 20 pounds? That's what I need to lose. Okay. And working from home has messed me up like this. Maintain a healthy weight. Yes. Practice safe food handling. You know, the other day they were interviewing, I shouldn't say, the name, but she was saying that you have to be careful the way you handle your chicken. In fact, she was saying that don't wash your chicken in the sink. Like you're better off, that surprised me. You're better off just cooking it without washing it, because after you cook it, it will kill the germs, than washing it in your sink, because in the sink it leaves germs. I say, wow, that's someone. If I said the name, we say, really? She said that? Yeah, she said that. That you're better off not washing it at all, rather than washing it and leaving all the whatever it comes with in your sink. Only if you clean up really well. Okay, so sicknesses that don't always need a hospital visit. I think some people visit the doctor too much. Okay, common cold or flu or mild flu. Minor cuts, something, just cut, bruise, mild fever. You know what to do. Headache or migraine without severe symptoms. Mild allergies, rashes, okay. Mild stomach upset and digestion. But people go to the doctors for this, I'm telling you. Minor sprains or strains, earwax build up, and mild, like something to do with your ears, right? You can clean them yourself. Clean them. Then sore throat, if it's not persistent or severe. Mild back pain. They said these can often be treated at home or with over-the-counter remedies, but see a doctor if symptoms worsen. Okay, let's move to ways to save on healthcare costs. I haven't put in my 2 cents yet. This is my research, but I have some notes over here. I put in my 2 cents. Okay, compare prices if you want to save on healthcare. Compare prices before procedures, medications. Use generic medication. That's like night and day. I remember I used to go to a pharmacy here, and at that time I didn't know about these generic versions. Like one medication that cost $70 was costing like $10 if you bought the generic version. I said, what? Yeah, it's like buying brand things. If you go to a store and you're buying things that are brand, like a brand name, they're expensive for nothing. Something that almost the same. So be careful about the generic version. And also they have coupons actually. The coupons you could use, maybe I'll come to that sometime. Okay, stay in the network with your insurance. If you have insurance, make sure you're picking doctors in your network. Take advantage of preventive care, often free with insurance. Those are the things we're going to talk about at the end. Go for tests, make sure you are keeping up with things before you get sick. Use telehealth or virtual visits when possible. Okay, like for your doctor, if you go physical, I think they bill you more. Ask for payment plans, financial aid if you're uninsured. Maintain a healthy lifestyle to reduce medical visits. We already talked about that. We are talking about saving money. Visit urgent care instead of ER for non-emergencies. Use community clinics or free health screenings. Like here at our masjid, they have, that's the first time I talk about having, because of my husband's accident, find out that I had pressure. My numbers, I was so stressed for a whole year. it brought blood pressure. But I remember I didn't know. My numbers were so good. I didn't know until we went to this community to at the masjid. They said, "Oh, the doctors are coming. Come check your numbers." That's how I got to know that my numbers were out of hand. I said, "What's going on?" But I could feel the stress. Can you imagine being stressed, sleeping like 2 hours a day for like a night for like 6 months? That's what happened to me. So they're saying when you have these any place they say they can check you out, go check, use that opportunity, okay? Use a check prescription discount cards or programs. They have those, yeah. Okay, now that's what I researched. How about the thing that they recommend you want to do if you want to prevent these visiting doctors, okay? I'll have a list for men, I have a list for women. I'm going to start with women. Okay, so you go for these tests even when you are healthy. So number one, you go check your blood pressure at least once a year. Assume you are healthy, you're not sick. Then cholesterol level panel. They said cholesterol panel every 4 to 6 years. I was researching this. That's how I got it. I'm not an expert. You can check it. But just the fact that I mentioned it, you can go do your own research. I mentioned blood pressure. I think once a year is even too late. I think you want to check it sooner than that. Even here in America, even grocery stores, they have this machine. You can go sit and check yourself. Okay, cholesterol panel every 4 to 6 years. Wow. That's too long. Okay, blood sugar, fasting glucose to screen for diabetes. They didn't say how long you should be doing this, like when. And then body mass index, that's to do with your weight, your waist, your weight. Monitor weight-related health. Then vaccinations and boosters. Do vaccinations. They're talking about shingles, COVID-19, all that stuff. Dental checkups, cleaning every 6 months. Yeah. Well, I talk about this. I said, we wait until you have some pain in the teeth, but actually it's supposed to go clean, just clean. Don't wait until there's pain. Eye exams, I'm still on this one. The last time I did an eye exam, I need to go, actually. Eye exam every 1 to 2 years. I need to go. Pap smear, if you don't know what a pap smear is, so women, especially women who engage with men, yeah, those kind of things, because they get something serious after it comes. It's called cervical cancer. So cervical cancer screening, if you sleep with men, that's the thing we're talking about. If you're a woman, just know that you have to do a pap smear. Check yourself out. They check you to see if there's no issues in your under there. So every 3 years, they say from age 21 to 65. Wow. You have to check yourself because they check to find out if you have cancer cells or something. In fact, they catch it really, really early if you want to do a pap smear. And if they do a pap smear and they find that it's abnormal, they say come back, because I think the recommendation is skip. You don't do, if you get a normal one this year, you don't have to go get another one, you skip. But if they find that a little bit abnormal, then you have to go again, and they take it very seriously actually. If you have some numbers, there are some tips if you don't want an abnormal pap smear that you have to. I wish I was off camera. I'll tell you what you have to be careful of before you go for those tests. But it's something I couldn't say right here. Okay, mammogram. Yeah, they check the breast cancer screening usually every 1 to 2 years, starting at age 40. Then bony density scan. Oh, DEXA to screen for osteoporosis, starting at age 65 or earlier. Pelvic exam as recommended by a gynecologist. Skin check, dermatology exam, especially if high sun exposure or if you have family history of skin cancer. And then a thyroid function test if symptomatic or risk factors. Have someone who is suffering from this thyroid thing. They have a lot of pain. It's very common. I didn't know. Okay, vitamin D, iron, B2 levels, if that or lifestyle suggests deficiencies. Cholesterol colorectal cancer screening, starting age 45. colorectal. I didn't know about this one. Colorectal cancer screen. I didn't know about this one. I need to find out. And that was for women. How about men? If you're a man and you're healthy, this is what you need to be checking. Blood pressure check at least once a year. Cholesterol panel every 4 to 6 years, like we did. Blood sugar fasting screen for diabetes. Body mass index the same. Vaccination and boosters, flu, diabetes, COVID-19. Dental checkups the same. Eye exams, prostate. Now this one is for men. We didn't have this for females. It's for men. Prostate specific antigen PSA test. You know, we had a discussion of Anna came and told us because he got this cancer twice, prostate cancer twice. So he came and he was emphasizing the importance, especially for Black men, to do this PSA test. Then they said discuss timing with your doctor. Usually starts at age 45 to 50. Testicular exam, monthly self-checks for lumps or changes. Wow, monthly. Abdominal aortic. Oh my goodness, these names I don't know how to read. And now aneurysm screening for men 65-75 who have ever smoked. Skin check, dermatology exam, especially if high sun exposure or family history of skin cancer. Hearing test. Why did they put hearing test for men and they didn't put for women? Especially if you're over 50. Colorectal cancer screening starting at age 45. And vitamin D, iron, B12 levels if diet or lifestyle suggests deficiency. Okay, all that I was just researching it and I was reading. Now, for me, I was watching some other research and they had some tips. Let me first give my own tip. When we had my husband had an accident, actually, it was very expensive. The bill, just for him to have surgery, he had surgery, I think 3 times. They were doing hard surgery on the arm, surgery on the stomach, surgery like that. The bill was over 300,000 USA dollars. But then also you have to pay, like, every time that you go to like physical therapy, they want to see how the bones are doing. You're also paying for x-ray and more x-ray and more x-ray and more. So what I noticed through those processes is cash. If you have cash, you pay, they charge like 30% less. So if you find yourself dealing with health care and you have to pay, always ask them for the cash option, because sometimes things are not covered by insurance and you have to pay. Ask for the cash option. Ask for a hardship option. They always have these options, but you have to ask. And someone was talking about yes, the way to save, like okay, the way, other tips, using honey. I use honey now. I told the story. I stopped using sugar because I saw a friend struggling, like they were injecting themselves. I said, what? I'm so scared. I want to use sugar. So I use honey. Avoid stress. Yes, I'm avoiding stress. You know, stress, you can avoid it. You can avoid stressful situations. Even when you're having a hardship, just work on it and believe it will get better. Don't stress too much over it. I learned that much later. I'm telling you. Yeah. And then flu shots. You know, I found something that was shocking. You know, they keep saying flu shots, come take flu shots. And someone said that starting from 6 months, people should have flu shots. But that 30,000 people die every year in USA because of flu. I said, really? Is that true? Because I hear flu shot everywhere. Come have a flu shot. But I didn't know it's so important like that 30,000 people die. So please, flu shots. And then someone was saying about mistakes in bills. Because you may have a bill that comes from a hospital and think that's your bill. Actually, she was saying how sometimes they misspell a name. Like they may post, like you went to a doctor like when my husband was in the hospital, they just keep adding everything they're doing, they bill it. But she was saying that they make mistakes sometimes in the codes. The way they code something, if someone quotes the wrong code, they may bill you for something far much expensive than what you really used. Then she talked about getting the name wrong. They could build something to you that's not. In fact, I saw something in Uganda recently when took a mom to the doctor. I was surprised because they recorded the whole conversation, right? And sent it to us, the children who are not there. And I said, that's into good. Like the whole conversation was recorded, like the audio. So they are saying that if you can take like a notebook to write everything that's happening, record it. Record what's going on when you go to visit, excuse me there. Because they make mistakes. They could bill you for something that you didn't do. I thought that was a good tip. Then they were talking about negotiating, which I said, you here in America, they always have those options. They have options for people without insurance. They have options for paying cash. And when we say cash, I don't mean cash like this. I mean you have the money available. It's not through bill insurance and stuff. That you can charge it like right there. Also the hardship. If you say you have a hardship, they always have these ways that they even have free clinics. You know, America is complicated. It's so expensive to be sick in this country, but they have free clinics, they have hardship, they have all these other options. Okay, so I think I already discussed the test. That's it. So how is your situation? How is your situation? If you are in USA, healthcare is bad. The things are really, really, really expensive. And I don't even know what numbers they have now, those people who are not insured at all. So it's really sad. It's a very sad story. There are people who believe that everyone should have insurance. Others believe no. So yeah, I don't want to get into the politics of it. But thank you so much for watching this. Add a comment for me. What did you take away from all the things I'm talking about? The reason I'm doing this is to encourage you to take a look at how you're spending your money and see if you can save some. And if you can, you see that you are actually not making enough, come, we have this school. We can make money. We can make more money. And where I want to end with this one, to encourage you to save money, to have emergency fund, to also start investing. Yeah, like all those people, what they do, the rich people, that's what they do. They save money, they invest it, it multiplies, and especially passive money. Passive money meaning something that comes every month, so that when maybe you are sick, something comes in. That's my mission. That's my intention here. Thank you so much for watching. And watch my other videos when I explain how to make money on school. Or if you want to come to my community, let me see. Let me put the link. I already put it, but I'll put it again. If you need my support to show you how to make money online. It's free. I made it free, although I pay for it, but I made it free. You don't have to pay any money. I show you, and the way you make money on it, you start free also. So they're doing things for us. It's our time now. It's our job to take it on and do it. And young men, most of the young men are really serious about this. They're making serious money. So thank you so much for watching this. This was number 4. Remember, I'm talking about 10. There are 10 categories of